timeliness of your presentation combined sort of with COVID-19. Burnout was a serious issue in cardiology before, and now COVID-19 sort of seems like this perfect storm event. How do you think COVID-19 will impact cardiology as a whole? And do you think that we might see a very real sort of impact when this outbreak is over?
Sure. I mean, we know that these COVID-19 patients suffer not only from respiratory issues, but also cardiac issues. And so I think cardiologists are really going to be on the front line of managing these patients, but we're going to be on the front line of managing things that we're not comfortable with as well, in terms of ventilatory issues, as hospitals are overfilled with patients, and there aren't enough pulmonologists. So I think that, the breadth of our patient and the extent of what we're used to and taking us out of the comfort zone is going to be an issue, as well as this is the first time as physicians we really have to feel the fear of contracting the disease as well. I know there was that time decades ago at the start of HIV, but this is the first time in current era that we really feel that stress. And the stress isn't one certain type of patient population that you can identify with the disease. It's anybody and everyone, and it's, it's your neighbor, it's your colleague, it could be your spouse or your child that gives it to you. And so that's what makes it challenging. So that fear is really also problematic. And I think it's the fear of touching a patient, which is so true to what we do as physicians, is having that interconnectivity with our patients. And so it puts a barrier for us and makes us think before we do things, which is unusual. I mean, we have to think before when we first meet someone nowadays. I mean, I'm so used to going out and giving my hand, and now I have to think, don't give my hand, don't give my hand, maybe put my hands together as a namaste, something different. So those are the real entities that we're dealing with as cardiologists. I think that the whole COVID-19 issue is going to impact the data that we have in the future when we reassess these numbers, is the fact that the prevalence of stressed and burnt out cardiologists is going to be on the rise. There's also going to be concern of PTSDs across the medical spectrum, from nurses and physicians to EMS, of the PTSD of surviving COVID and dealing with situations that put you outside your comfort zone. And so we need to recognize that these entities are there. We need to recognize that we may be suffering, and we need to recognize that it's okay to seek help. We also need to recognize when those around of us are not healthy and not doing well, and we need to kind of rein them back in and help them. And so not only helping ourselves, but helping each other survive this. And there are tips like, making sure that we're staying healthy, that we're exercising, that we're eating well, we're sleeping well, making sure that we're finding time that's non-COVID time. When you turn the TV on, you turn the radio on, you look on your emails, all you see is COVID, COVID, COVID. So finding a space that's COVID-free for discussion is key. So giving your brain like a break from this whole COVID stuff. Understanding that we can't control everything is going to be hard, but we're going to have to learn how to relinquish the control and just leverage the strengths that we've had in the past to survive things to use at this time. And then making sure that you keep a close knit of friends with you that you can discuss your concerns and feel safe discussing them is going to be essential. And it's also very, very important to remember that social distancing is important, but it does not mean that you have to be socially isolated. So you can still reach out to people. In the advent of cell phones and social media, there are so many ways to connect to people across your offices, across town, across the globe.
All right, and now staying on the topic of COVID and sort of its overall impact on cardiology and medicine as a whole, one of the obviously most concerning impacts of burnout is people leaving their field or leaving medicine in general. I've seen a lot of physicians on Twitter really sort of answering the call to action that COVID has put forth. Do you think, though, that after this outbreak, we might see more physicians leaving the field just because of something that's this stressful and this impactful, and as you said, could leave many physicians with sort of a PTSD?
Yeah, I mean, that's a great question of will physicians leave the practice of medicine based on COVID? It's all speculation. I mean, are there many out there that are like, gosh, can I retire now? I've heard that of all ages, but some of us are too young to do that. But so yes, it's impacted that way. But those that are on the front lines, will it impact them to leave earlier? Sure. I mean, if you're burnt out people do leave their jobs or situations earlier. Um, uh, the bigger thing is it going to affect the future generation of physicians? Are we going to be impacting the future generation of medical students that want to go into it? You know, many medical schools are graduating the students early, and they're excited, some of them, but some of them aren't excited about that and being thrown out in the front lines and not knowing of this disease battle. You know, we're not, majority of us are not warriors in that per se. We're book warriors, that's for sure, but warriors in this way is very different. And so it's going to be interesting to see what kind of impact it has on the field. And then, you know, it's the balance of the work-life balance of how many hours I'm putting versus time I have with my family versus the finances of it. And is it really worth it versus having a computer desk job? Is going to be on a lot of future generations of kids' minds. But I will say that I have seen such a rise in the respect for healthcare workers over the last few weeks because of the COVID-19. And now there's a hashtag healthcare heroes, which is new as well. And I think the respect, and it's just heartwarming to hear of people standing on their balconies, even in New York, just like in Italy, 7 o'clock, clapping their hands in support of healthcare workers, not just the physicians and nurses, but also the EMS and the whole care team.